Mayor Isko Moreno is invoking the local government code. Harry Roque is saying, no, this is an order direct from the President. Alin po dapat manaig dito?
Well, as of now, for me, the national policy promulgated by the IATF and the President is the wearing of face shield in the 3 Cs, in the enclosed spaces, crowded places, and in close contact situations. So yung close contact, yung hospital, di sila nag-argue doon, no? That we're taking care of positive, mag-face shield tayo. Ang ina-argue nila is whether it should be used in the outdoors, no? Approved na naman yan na hindi gamitin outdoors. So ang problema na lang is public transport and ano pa yung isa, crowded places. So ako, if you ask me as a physician, I am more comfortable with 3 levels of protection than with 2. Kasi yung 2 na sinasabi ko is just the face mask and the vaccine. Di ba? But if we had a third layer, then it's actually more protection. However, no, I would like to clarify, not everyone has a very high level of vaccination as Metro Manila at 87%. Sa ibang probinsya, sa ibang lugar, it is only 35%. So in places like BARM, it is only 5%. So baka nga hindi naman universal yung pag-lift ng face shield policy. So there will be a meeting tomorrow with the IATF and they will probably discuss the policy for the next phase of our face shield wearing.
Okay, so we talked about the policy. Let's talk about the science. I mean, does the science and evidence and research bear it out? What you said, that this adds an extra protection of an extra layer of protection. Because I mean, if that is the case, then why are we the only country left mandating the use of face shields?
That's correct. Huh? I think we need more robust science to actually implement it in the public sector. All hospitals and all areas put it on as an additional protection. So our theory is that if it works in the hospital, it should work in a public place where there is a high level of transmission. Right now, our test positivity rate is only 5.7%, I think. The latest report is only 5%, very close to the 5% that the WHO desires. No, which means I think the face shield can be removed if you are at that level. However,
nabanggit niyo po, I mean, Dr. Herbosa, nabanggit niyo po yung mga hospitals. We've spoken with scientists as well as doctors who said we can completely understand kung bakit sa ospital. The face shield is really for protection from fluids, splashing everywhere. And the doctors themselves are saying it was not really designed for air movement.
That's actually true, no? It is just an additional layer that we used last year. But remember, when the rest of the world had Delta, they imposed a double masking policy. But we didn't. We just kept the face mask and the face shield. And we were okay. We didn't have as high a surge of Delta as the other countries.
We were wondering about your medical expertise. Yes, sir. Yes,
Yeah.
ma'am. Your medical expertise
Well,
po.
ever since naman kasi, the view about the face shields is that it provides an additional layer of protection, particularly to prevent entry, no, of droplets into the eyes. Kasi it's a portal of entry talaga. Now, syempre, when we talk about using PPEs, you balance the risk of transmission, where it enters, and the rate of transmission. And one of the things that has really changed in the past few weeks is the fact that we are on the downturn in terms of our cases. We have decreased our alert levels. And so it becomes appropriate again to re-examine whether all of the PPEs need to be in place, some of the PPEs need to be in place, or we can modify.
The infinite scenarios that you can imagine kids getting into. Kasi ang dami, di ba? Parang public transport, malls, restaurants,
Playgrounds,
indoor dining, al fresco, now even gaming, going back to computer gaming centers. Which will give you more the most fits?
Siguro kung I think many of us naman have imbibed the habit already of using our PPEs properly. Medyo nag-hesitate ako doon kasi marami pa rin ako nakikitang hindi tama ang suot. Pero sige, granted na
Actually,
lang.
ma'am, marami pa rin talaga yung nakababa
Oo
yung
nga
mga
eh.
face mask.
Pero I think wala naman yatang nangangahas ngayon na lumabas na wala man lang face mask. Kahit na medyo alanganin yung suot, kahit papano, I don't think we're used to leaving our homes now without face mask. So kahit papano, we can do that. I think the only other thing that would I would remind kids about and their families is be conscious about air quality kasi hindi siya top of mind sa atin eh.
Yeah. And what about yun na nga, yung face shield. I mean, pati ba yung mga bata pag face shield? Assuming na i-insist pa rin ng IATF na kailangan pa rin ng face shield. I'm just trying to find some logic in this protocol, no? Because
Okay.
there's so much debate over whether face shields work or not, and yet, now we're allowing the kids to go to crowded places. So parang feeling ko, halimbawa yun, parang aren't we rendering them, going by the logic, more vulnerable now? I mean, they're unvaccinated. I don't think that there are face shields tailored for kids, especially 2-year-olds or 3, whatever. No, aren't we subjecting them to, the dangers of this virus if we go along with the IAPF warnings on the virus being still out there? Parang hindi ko makita kasi yung consistency sa decisions on the protocols. No? So, yeah.
Well, siguro the decision making is not, it takes into consideration a lot of other factors. But siguro if we were just to talk about the science, di ba? Siguro the easiest way to understand this is in the healthcare setting. Even before COVID came along, eye protection was necessary for certain procedures because we knew that you could get virus or bacteria and infect yourself as a healthcare worker if you didn't have the proper eye protection. So,
Yes.
etong COVID actually just adapted those processes. And so, whatever IATF decides for the general public, the science will still support the fact that if you have this additional layer of protection, it's going to help you with avoiding infection. Hindi magbabago
will we
yung
let
ano na
the
yun. Hindi
kids-
magbabago yung reality na
Yeah.
yun, di ba?